2.5 million children die each year from diseases prevented by vaccines recommended by the WHO.
The burden of these deaths falls mainly on the shoulders of Africa and Southeast Asia.
At this moment, 23.2 million infants worldwide are not immunized against diphtheria, tetanus, and pertussis. 70% of these children live in just 10 countries.
Vaccine-preventable diseases spread quickly, especially in crowded, unhygienic conditions like conflict zones. These are often the places that prevent children from being vaccinated.
Vulnerable populations, such as refugees and nomadic groups, are often seen in multiple locations. Lack of centralized immunization records contributes to extra immunization in some and under-immunization in others.
Where handwritten records exist, they are often out of date, difficult to read, or forgotten.
Even in developed countries like the United States, vaccination records are problematic.
Oh, take me back to the start.
Over $26.5 million are spent annually on redundant vaccine doses, and almost 2 million unnecessary doses are administered, contributing to the rising costs of healthcare and the potential side effects of vaccines. Imagine a world where vaccination records are centralized and easily accessible.
Imagine a world where the power to access these records fits into the palm of your hand.
Happiness hit her.
With just a fingerprint reader and a cell phone, any healthcare worker anywhere in the world can access and manage their patient's vaccination records. The idea is simple. When a patient arrives for a vaccination, the healthcare worker applies the patient's finger to the fingerprint scanner built into the phone. The fingerprint is transmitted wirelessly to a secure central database server where the biometric scan is stored, along with the patient's vaccination record and personal identifiers. Moments later, the healthcare worker will receive an SMS with the patient's vaccination record. Healthcare workers can evaluate what vaccines are needed and update the patient's vaccination record via text.
It's so easy, my baby could do it.
Project Thumb! The power of public health in the palm of your hand.